Hi, Pediatric Squad. Welcome back to the channel. I'm Oliver. So today we talk about RSV immunization in children. So which is a very hot topic recently. Many papers are publishing different things and many guidelines are publishing. So one of the new drugs is Nirsevimab. So why it can change the game, I will tell you bit by bit in this presentation. And I will also give you an overview of the new picture of the RSV immunization. So let's get started and stay till the end. First of all, my story. What is happening to RSV? We are all pediatricians, so we admit RSV every single day. I have a 2-year-old girl admit to pediatric ward because of shortness of breath and fever. Eventually, she presented with subcostal insufflation with generalized wheeze over bilateral chest. We diagnosed her for acute bronchiolitis, and PS came back to be RSV. Eventually, unfortunately, she needed the high flow nasal cannula. In my hospital, if we need a high flow nasal cannula, we need to go to the PICU, pediatric ICU. So she was admitted. And this happened every single day. Not everyone needs a high flow oxygen, but then we admit children with difficulty in breathing every single day due to RSV. So this is the most common scenario in pediatrics. What if we can prevent it? Okay. We need the vaccine, right? Or we need the immunization. So this is what this presentation is about. So disclaimer, this is for educational purpose only. Don't treat this as medical advice, just for sharing educational purpose. So before we talk about everything, we need to know what is RSV doing. Not only bronchiolitis, it can actually lead to severe consequence. According to this study in 2019 published in Lancet, in 2019, for the children lower than 5 years old, the death attributable to RSV are actually more than 100,000, which is a lot. So 100,000 of children lower than 5 years old pass away due to RSV. So what are the complications? Apart from bronchiolitis, I think this table beautifully illustrates what is happening. So most common still pulmonary infiltrates, atelectasis, pulmonary complications, otitis media. Some of them may have the hepatitis, respiratory failure. Rarely, sometimes they can lead to like sepsis, meningitis, or even encephalopathy. But of course, this is less common. Most common will still be the respiratory complications. So when we talk about RSV vaccine in our medical school or back in my medical school days, we talk about Palivizumab. This is a traditional vaccine. I quote is this vaccine because it's not exactly a vaccine. It is a monoclonal antibody instead. A vaccine is that when you inject that, your body, your immune system has the reaction, they produce more antibody when you have the second attack, right? But monoclonal antibody like Palivizumab is directly neutralize or directly kill the virus. All right. So these, do remember there are difference between monoclonal antibody and vaccine. It is a very old drugs. As you can imagine, when I was in medical school, I've heard of this thing. So this is quite old. Okay. So in 1998, this is one of the landmark studies which shows that Palivizumab can actually prevent the incidence of hospitalization due to RSV, especially in those high-risk infants, which means those preterm baby or those with chronic lung disease. But this is a problem. This monoclonal antibody has short half-life. They need 1 dose per month. Okay, so in order to prevent the whole RSV season, you need to give the baby 5 doses in total, and which 1 dose per month. So this is the problem with Palivizumab. First of all, it's quite expensive. It's more than around $4,000 per dose, and it need monthly dose for 5 doses. So you need to inject the baby every month for 5 times, and it's very expensive per dose. So this is the problem. However, good news is there's new drugs. Nirsevimab. Nirsevimab can solve both the problem, the cost effectiveness, and also the regular injection. You only need 1 dose. This is also a monoclonal antibodies. So strictly speaking, it is not a vaccine. It is a monoclonal antibody. They neutralize the virus directly, not boosting your immunity in order for your body to kill the virus. Okay. So good news is You need one dose only for one RSV season. Most of the time, the effect can last for like 4 to 5 months, which is one RSV season, and it's more cost effective. So it's a relatively new drug, not very new, but a bit new. It's approved in Europe in 2022, and it's also approved in UK, Canada, and USA in 2023. So why Nirsevimab is better than Palivizumab? We can actually go back to the mechanism to understand why. So first of all, imagine RSV is the main character in Dragon Ball. I'm sorry, I really don't know the English name of that because I don't watch it in English, all right? Gaku, is it pronounced like this? I'm not sure. Do let me know in the comment section how to pronounce him. So imagine he is the RSV, all right? And this pink back character is the human cells, okay? So RSV need to attack the human cells. In order to, because this is the smallest version of the RSV, they need to evolve in order to be able to attack the human cells, right? They need to evolve, okay? In order to evolve, they either need like the stronger mode, the super saiyan mode, stronger mode, which is the prefusion F protein. They need the prefusion F protein to kill the human cells, or the intermediate mode, okay, the post-fusion F protein. How to differentiate super saiyan mode and the intermediate mode? You see the color of the hair, all right? Yellow color, very strong, more muscular. Black color, weaker, but intermediate. Is definitely better than the small child that we have just seen, all right? So for Palivizumab, what they are targeting, they target both the super saiyan mode and the intermediate mode, okay? They target both the prefusion F protein and the post-fusion F protein. So you may say, okay, they target both, it's good, but actually not. It's not targeted enough. It's not focused enough. They waste the energy. So this is one of the bad things about Palivizumab. However, for Nirsevimab, they only target the super saiyan mode, the prefusion F protein. So which make them more focused and then to have better effect. So this is why Nirsevimab is better than the Palivizumab, because they only target the prefusion F protein. How effective is Nirsevimab? So this is a study published in Lancet Infectious Diseases in 2024. So Galicia in Spain, which is one of the earliest places who gave universal prophylaxis of Nirsevimab to infants. Okay, so this study tried to see the real-world data of how effective Nirsevimab is in the infants less than 6 months old. Actually, it's quite effective. So for the severe RSV, lower respiratory tract infection requiring oxygen, the effectiveness is up to 87%. Prevent the RSV-related lower respiratory tract infection and leading to hospitalization, the effectiveness is 82%, which are very good numbers. So the number needed to prevent one RSV-related lower respiratory tract infection for the hospitalization is 25. So which means when you inject 25 infants, then you can save one baby from hospitalization due to RSV, so which is quite good, all right? And more importantly, is relatively safe drugs. There's no serious adverse event detected in this study population. So which means this this monoclonal antibody is quite safe. But having said that, what are the adverse effects? Again, like all of the drugs, allergy, like all of the injection, pain, swelling, or hardness at the injection site. If you have the severe allergy reactions before, you can't inject that anymore. This is contraindication. And we need to be cautious because it's an injection. Those with bleeding disorder, we need to be careful. Or those who are having moderate to severe illness, we need to be careful. All right. But other than that, seems that there's not much serious adverse effect, according to the study. So who should receive Nirsevimab? We have said that it is quite good. Who should receive it? Is it only the high-risk infants or other people? So we can take reference from the American Academy Pediatrics recommendation, which is actually only published in August this year. They recommend almost all infants below 8 months old, they should receive the Nirsevimab or the other alternative. I will talk about it later. For those during the second RSV season, 8 to 19 months, those high-risk infants should receive the Nirsevimab. So what exactly they are saying? Okay, so Why I say almost? Okay, because generally they recommend all infants less than 8 months when they're born or when they enter the first RSV season, they should receive the Nirsevimab. However, for the infants whose mother have received the PF fusion protein vaccine during their pregnancy, they do not need the Nirsevimab. Okay, so only this exception. Otherwise, all infants should receive the Nirsevimab. But of course, if the mother received the vaccination, they need time to produce the antibody. So only those infants who was born more than 2 weeks after the mother received the vaccine, they do not need the Nirsevimab. So this is the recommendation by the AAP in 2025. So I've said that there's alternative to the Nirsevimab, which is Clesrovimab. Okay, so I will talk a bit later on. So for second RSV season, like the children with 8 to 19 months old, they recommend that the children with high risk of severe RSV disease, they should receive the Nirsevimab. Who are they? Including those premature baby with chronic lung disease, those who are severely immunocompromised, those having cystic fibrosis with either severe lung disease or failure to thrive, those American Indian or Alaska Native children. And for these high-risk children, even their mother has received the vaccine before, they should receive it in the second RSV season. So what is the alternative to Nirsevimab? I've just briefly mentioned it. This is Clesrovimab. Correct me in the comment section if I pronounce it wrongly. All right, thank you for that. Clesrovimab, actually similar to Nirsevimab. It is a long-acting monoclonal antibody. So it's approved by FDA in June 2025 and approved by the CDC in August 2025. Study shows that it can reduce RSV-associated hospitalization by 84% through 5 months compared to the placebo. So adverse events similar. Usually most of the time are those injection site reaction. So this is even newer drugs than the Nirsevimab. It can be one of the alternative to that, according to the AAP. We have said that Nirsevimab, Clesrovimab are quite good. Shall we still give Palivizumab? So this is the AAP 2025 recommendation. They said that Palivizumab is no longer routinely recommended for use and will be discontinued in the end of 2025. But of course, AP is from America, from the USA. In some countries, maybe the Nirsevimab is still not registered, or in some resource-limited countries, is still not available. They may still use the Palivizumab. It really depends on which countries are you in, which places are you in. But at least for the USA, they no longer recommend it. So how about maternal RSV immunization? I've briefly said that for those who have received it, whose mother received the vaccine, they do not need to receive the Nirsevimab. So what is this vaccine? In 2023, the FDA approves the first vaccine for pregnant women to prevent the RSV in infants. All right? They can prevent the lower respiratory tract disease for the infants from birth to 6 months of age. So it is called Abrysvo. So it's approved from those pregnant ladies who had 32 to 36 weeks of gestational age. And I need to emphasize that it is a vaccine, not monoclonal antibody. So vaccines mean after you inject to the mother will produce the antibody, and then the antibody will go through the placenta to the baby so that the baby can have the immunity. So it's different from the monoclonal antibody. Again, good things about this is they target the prefusion F protein as well. So this is better. Focus. So because as you may all know that when the placenta transfer the antibody, generally it can last for around like 6 months. So it's the same like other antibodies. So it can last up to 6 months. And how effective is it? There's a paper published in the New England Journal of Medicine. It can reduce the risk of RSV lower respiratory tract disease by 51%, so which is quite good. At first event, again, injection site discomfort, the mother may experience headache, musculoskeletal pain, nausea, but typically resolve within a few days. So it's generally, again, a relatively safe vaccine. However, there is one concern from the FDA. In the phase 3 trial, the investigator observed that there is 1% difference in preterm birth in the vaccine group versus the placebo group. Therefore, they only approve this vaccine to administer from 32 to 36 weeks of gestation. We are not quite sure whether this vaccine can lead to preterm birth yet because of the 1% difference. In order to prevent the extreme prematurity, they approve it to inject for 32 to 36 weeks of gestation. Maybe later when we have more data, we'll know more about this. Thanks for watching. There are a few key takeaways from this presentation. First of all, we need to know that RSV burden is high and it can have severe complication or even lead to death. Palivizumab is a traditional monoclonal antibody, but now it starts getting more and more out of favor. Nirsevimab, or its alternative Clesrovimab, has longer effect and now recommended by US for almost every infant, except some. Alternative, we can consider vaccination to pregnant women, which is also an effective choice. So thanks for watching. This is just a start, okay? I hope this video can let you have a very brief overview of the RSV immunization. But I always think that no AI, no YouTube channel, no one can actually replace your own readings. So I will actually put all the suggested references and reading in the description so you can check it out. You can read it on your own and then you will get more. So if you want more video like this, after you watch the video, you can have an overview. Do welcome to subscribe my channel or leave the comment section below what topics you want me to cover, or if you have any questions or you want to teach me what is the English name of the Dragon Ball main character, do leave me in the comment, alright? And do subscribe my channel. I also have a newsletter. If you would like to receive some of my emails from time to time about the updates in the pediatrics, do subscribe my newsletter. I'm very happy to share with all of you. Let's grow together as a pediatrician to help our children. Alright, see you next time. Bye.